Hi everyone, welcome to Three Things About. For those who don't know me, my name is Rizwana Chowdhury, an advanced nurse practitioner here in the UK. And for those that do, who've been here before, welcome back. Now I know I've been away from YouTube for over 4 weeks and I wanted to explain why. My dad was admitted to hospital as an emergency with a life-threatening condition, and it's been one of the most difficult months of my life. But I've learned so much and I want to share that with you today. So my dad developed a small bowel obstruction. Just to clarify, the word small refers to the small intestine, not the size of obstruction. The small intestine is situated between your stomach and your large bowel. So what happened in my dad's case is an old appendicectomy, so a removal of his appendix 20 plus years ago, formed adhesions, which is scar tissue. And that scar tissue blocked his small intestine and therefore blood supply. That blockage led to mesenteric ischemia, which is literally losing blood supply to that area of the gut, which triggered sepsis, which is a severe body-wide infection. In this video, I want to share with you what these conditions are, how they happen, how they are treated, and most importantly, what I've learned as 3 practical lessons from this experience so far. So let's get into it. So let's start with the basics. What is small bowel obstruction? Well, it is the partial or complete block of the small intestine, stopping food, fluid, and gas from moving through. So what causes small bowel obstruction? We can look at adhesions, scar tissue from old surgeries like appendicectomy or gallbladder removal, conditions that consist of severe inflammation like Crohn's, tumors, hernias because the bowel can get trapped, all of which can cause small bowel obstruction. So what are the symptoms? The symptoms include severe abdominal pain, so bad that simple movement becomes difficult, vomiting, abdominal distension, and also no bowel movement, including passing wind. 1 or 2 of these symptoms should trigger urgent medical attention, and please do not delay. An obstruction can become life-threatening very quickly. So what is mesenteric ischemia? The mesenteric arteries are a network of vessels that supply blood to not just the bowel, but other abdominal organs. Ischemia simply means the cutoff of blood supply to a part of the body. Mesenteric ischemia is when blood supply to the small intestine is cut off or severely reduced, and this can be caused by a blocked artery, pressure from an existing obstruction, or reduced blood flow due to sepsis or shock. The danger here is without blood supply, the bowel tissue begins to die, releasing toxins that can potentially trigger sepsis. And here's the key point. We can't live without our small intestine, and it's very different to the large bowel. The small intestine is where nearly all our nutrient absorption happens. So if blood supply is not restored very quickly, mortality rates are high. So how is mesenteric ischemia of the small bowel diagnosed? One of the most clearest warning signs is severe abdominal pain with no bowel movement, including passing wind. And this is exactly what happened in my dad's case. He had severe, excruciating pain with no bowel activity whatsoever. From there, tests confirmed what the team suspected. My dad's blood test showed CRP and WBC were elevated. CRP is C-reactive protein and WBC is white blood cells. Both were elevated and markers for infection and inflammation. They also tested his lactate, and in this case, anything above 2 lactate would suggest or worry anyone about poor tissue perfusion and possible ischemia. At one point, my dad's lactate was 9, showing how urgent his case was. A CT abdominal scan was done, which is the gold standard, which confirmed the diagnosis. Initially, the plan was keyhole surgery, but in my dad's case, the ischemia was far more extensive than anyone hoped. The surgeons quickly realized that they would have to convert to open abdominal operation. During this operation, they removed a section of the small bowel. My dad's inflamed gallbladder was removed and a stoma was created to divert waste safely. The surgery took more than 5 hours in total. After surgery, the battle wasn't over. My dad went straight into intensive care, where he was on a ventilator to support his breathing. He was on strong medication to support his blood pressure. He was on antibiotics to fight infection, and he was receiving nutrition via a tube. The reality was tough. He lost a lot of muscle mass, experienced episodes of delirium, and we lived a constant fear and worry about infection. But step by step, he started to stabilize. And today, the progress is real. He is eating again, building strength. And although recovery is ongoing, he is moving forward every day. I'll be honest, there were moments in ICU, I thought my dad wasn't going to make it. There was a time where his blood pressure was so low, I thought we were losing him. And there were maybe 2 other occasions where I truly felt that we could be at the end. And those memories will be with me forever. During this time, we made good friends with other families who also had a loved one that was fighting for their lives in ICU. And sadly, not everyone made it. And to witness those losses alongside our own battle was one of the most difficult things I've ever experienced in my life. It gave me even more appreciation towards the staff and the fragility of life itself. Here are 3 lessons I have learned so far. Number 1, prevention. Build your reserve before illness. One of the most clearest things I have noticed is the effect of severe illness on the body. Delirium, muscle loss, and weakness. Much of this is worsened with the use of opiates for pain relief, which can cloud thinking and reduce mobility. And in my dad's case, once he came off opiates, his strength and mental clarity improved. The lesson here is not avoiding disease, it's about maintaining fitness, muscle mass, and diet before illness strikes. The more better physical reserve you have, the better your body will cope through serious illness and major surgery. Evidence shows patients with better baseline muscle mass spend less days on a ventilator in ICU and have a lower mortality risk. That means daily movement, strength exercise, and adequate protein intake are not luxuries. They are protective factors for future illness. It doesn't matter if you are 30 or 70. My dad is 73 and he worked out every day. The fitter and stronger you are, the better your body fights back. Number 2, early recognition. Some of the most important lessons I have learned from this experience is early recognition. Acute pain, especially when it's severe and sudden and associated with vomiting or distension of the abdomen and the inability to pass stool or gas, should never be ignored. These can be signs of bowel obstruction or compromised blood supply. Many people assume abdominal pain can just settle on its own, but in the case of mesenteric ischemia, every hour matters because bowel tissue starved of blood supply can begin to die. If you've had previous abdominal surgery, it's crucial to understand adhesions are like internal scar tissue that can wrap around and squeeze the bowel years after surgery inside the abdomen. These adhesions may not cause problems for years and maybe even decades, but they are actually the most common cause of small bowel obstruction worldwide. Anyone with a history of abdominal surgery, including my own husband, recognizing the symptoms early can mean the difference between a simple hospital admission and emergency life-saving surgery. Number 3, recovery. Nutrition matters. Healing from major abdominal surgery and sepsis is not a race. Nutrition needs to be reintroduced slowly, and here are the 5 steps my dad took to restore his nutrition. Step 1 is TPN, which is IV nutrition. When the bowel isn't safe to use yet, all nutrition comes through a vein, and this keeps the body nourished while giving the gut complete rest. You then have step 2, which is clear fluids. So once the team think it's safe to try the gut again, the first step is clear fluids. So water, weak tea or broth, and these are easy to absorb and let the doctors really check if the bowel can tolerate anything without causing pain, bloating or sickness. You then have step 3, which is free fluids. If clear fluids are tolerated, the next stage is free fluids like soups and yogurts and smoothies. These are still gentle on the gut but provide more calories and protein. You then have step 4, which is soft diet. Then comes soft foods like mashed potatoes, scrambled eggs or porridge, and these are easy to chew and digest but start to feel more like real food again. And then you have step 5, which is where my dad is right now. It's solid foods. It's when the gut is coping well. Normal solid foods are usually reintroduced slowly. The idea is not to overwhelm the intestine, but to build confidence that it can handle digestion safely. Rushing this process can cause complications like leaks or intolerances or infections. So this gradual reintroduction allows the bowel to adapt safely. So for those wondering why I haven't uploaded, this is why. In fact, my dad ended up in the ICU I trained in many years ago, and my skills and knowledge from back then was definitely the forefront of this journey, helping me make sense of everything that was happening day by day. I want to thank the teams that took care of my dad, from the ICU team to the current ward staff. I don't know if you'll ever watch this, but this is a big shout out to you, and a thank you to each and every one of you. This is a very niche topic, I know, but I thought it was important to share. Even if one person finds comfort or clarity from this video, whether you are taking care of a loved one or just learning about your own health, it's been worthwhile. And if you are wondering, how do I stop this from happening to me or my family, my next video will be on vascular health that ties into gut, brain and heart health. So keep an eye out for that. Thank you so much for your patience while I've been away. I look forward to coming back with more consistent uploads, not only content that's engaging, but life-changing and practical when it comes to health. If you found this video to be helpful and useful, don't forget to share it with anyone that you feel may benefit. Take care of yourselves, and I look forward to seeing you very soon in the next video.